Well, good morning, Davenport. I'm here today with Dr. Katz, our infectious disease specialist from the county. We're very fortunate to have him, so I'm going to do a few things, announcements first, and then kind of ask him to give his thoughts on some questions that we've been getting in Davenport and, of course, in the community. Just so you know, when you hear it from me, that's nice, okay? But it's really important to hear it from the person that deals with this, and his life work has been dedicated to this. So I'm just going to take some time and give you a quick couple updates on COVID. Of course, if you go to our city website, the big red sign on our city website that says COVID-19 response, a lot of questions, whether it has to do with small businesses or some of the ways they're doing benefits to help folks or other issues. We're trying to keep that updated daily, and a lot of the information, maybe the questions you have are there. So I'd encourage you to go to the COVID red sign on Davenport City website. Some specific additions for you guys, everyone today. The city of Davenport, we've closed several of our park structures. So basically I'm telling people the grass is open, but the places where you are doing things specifically like basketball courts, skate parks, our playgrounds, tennis courts, pickleball, and restrooms are closed. And ladies and gentlemen, please, this is for your protection and the community's protection. We need to do some of these things to ensure we mitigate the spread of this virus. But the parks remain open, walking and doing some of the things like that. We want to have an outlet for you guys. We encourage you to take your dog for a walk, go for a run, or ride your bike. Just remember when you're coming close to someone, remember that 6-foot distance and that social distancing. Again, to help try and mitigate the spread of the virus in our community. These are all easy to do as long as we maintain our 6-foot distance. And if you help with the social distancing 6-foot distance, then maybe we can help slow this spread, and at some point in the future, we'll have some sort of normal back to us. So again, I'm privileged, and we're all privileged to have Dr. Katz with us today. So I just have some general questions and comments for him that you guys in the community have been asking, and we're just wanting him to give some of his thoughts and guidance. So without further ado, Doctor, again, thank you very much for coming, and appreciate you talking with the citizens of Davenport.
Thanks for the invitation.
Yep, and all the hard work you guys are doing, and know that myself, Ms. Spiegel, our city administrator, and many others, Ms. Ott, our public information officer, are talking daily with these folks. But I wanted an opportunity for him for you guys to see him directly. So, sir, so Dr. Katz, what are your thoughts on? We're getting some folks to, we think, and quite frankly, they say it, a little false sense of security because of the testing or maybe the positive results aren't a huge number like they are in other parts of the country. People are feeling that it's just not coming here, and I'd love to hear your thoughts maybe a little bit about that and what you think is going on.
Well, it's true that testing has been limited. Those limits are being raised slowly as test kits become available and more testing is being done. I'm not fixated on testing. I'm more interested in the relationship between the number of cases that we identify, number of people who get sick and get tested. We assume in surveillance is a relatively fixed proportion of the number of infections out there. And it probably will surprise some people, but there are estimates that every case that we identify represents between 50 and 100 infections.
Okay.
And so I watch the direction of that curve of identified cases and use that to understand, not as precisely as I would like, but I use that to understand what I think is really out there. And so if we've seen 10 cases, I think there may be as many as 1,000 in the county.
I understand.
Or maybe it's 500. Number's not exactly right, but we know the direction that things are moving by understanding the number of cases. So we're not as blind as some people have led the public to believe.
And I appreciate that, especially coming from you. I think a lot of us are understanding those thoughts, but But I think it's important for our community out there to understand, don't assume because the testing positive cases is not a significant number as many people would compare to other places. Know that is, and I hope everybody heard what he said, that there's still a fair amount of exposure.
There's a lot of it,
Roger.
potentially. We don't, the numbers aren't clear yet, and they will become clear as time goes on. But what we see as cases represents the tip of the iceberg.
Yeah.
People need to think in those terms.
That's a good way to say it. Thank you. And what I hear people talk about, and I think most do now, it's more of a marathon than a sprint with the social distancing and the requirements we're putting on. So as many professionals we've seen nationally state, and of course you guys, talk about the curve and limiting the height of the curve or the increase quickly of the curve so that we can give our health professionals, our hospitals, a chance to deal with this. So if you could talk a little bit about that, that it's a marathon, but the curve especially.
Yeah, we need to be looking at what we're doing and additional things that I think we're going to be doing in terms of weeks and months, not days and weeks.
Roger. Okay.
I think it's very important. I'm not making any plans in June or July.
Right.
As I told you, I've turned down speaking engagements in Europe in late May and June. And right now, I wouldn't accept one until maybe September,
Okay.
tentatively. I don't know, but I'm not going to spend any money and then find out it was a non-refundable ticket.
I got that, Doctor. Thank you. And more specifically, maybe to the Quad Cities, our community, you would impress that upon us here also as nothing in June or July, maybe.
Well, yeah, I mean, if you're planning a big event in June and you're going to put out a bunch of money to get it up and running,
Right.
I'm pretty sure that right now I wouldn't do that.
Fair enough. That's a big risk you'd be taking.
Yeah, you're risking your resources.
Right.
We had this occur a couple of weeks ago out at the fairgrounds with an enormous event. Had to be canceled on 3 hours' notice.
Yeah.
And it cost the gentleman a lot of money. I don't want to see people in that position.
Sure.
So people need to be very careful.
Right. And the overall thing is this is difficult for many people. In fact, terribly difficult for many people, but we've got to do everything we can to mitigate the spread. So
Yes.
Big gatherings just is not part of this for months in our future. So.
The less we do now, the more we're going to have to do in June, July, August, September.
Yes, sir. So what is, I know you talked about testing, you're not focused on that, but what's the current guidance that you could share for folks that think they should have a test or are getting a test?
Because of the limited supply, we want to see people tested where the test result is going to make a difference in how we take care of them, what we tell them to do. So that's primarily people with significant illness.
Okay.
Beyond colds and flu, perhaps people that are living and potentially exposing people at very high risk for bad outcomes, those sorts of things. The testing criteria changed, and they're very clear and simple. And you go to the Iowa Department of Health or Illinois, depending on which jurisdiction you're in. But you go to the IDPH website,
Right.
And they're laid out pretty clearly.
Okay, thank you. So in reference to that sort of, what is the guidance? I assume I'm kind of asking the same question, maybe in a different way. The guidance to our health professionals, when someone calls and says, I need a test, it's basically the same thing then, right? Yeah. They just are simply going by that criteria. Is there discussions maybe going forward or ongoing now that the criteria would open up more, I guess, based on getting the more testing? Then?
Yeah, oh, absolutely. When tests are abundantly available, anybody wants a test can probably get a test. There is equipment made in the U.S. By large medical device firms that have throughputs of thousands of tests an hour.
Okay.
And in fact, that equipment exists in the Quad City metro area. However, the reagents to do the test are the bottleneck. Making the test kits to run on the machines is an extraordinarily complex process. and you don't throw a switch and have unlimited testing available. It's taking weeks, and we knew that. As this began, we knew that to ramp up testing would take weeks to a month or two, and it's going to take that.
Okay, thank you. Some folks, I think, going back to the original question, maybe that we're not taking it serious, talk a little bit about many people, and if I watch the national folks like Dr. Fauci and others, can be carriers, not have symptoms, you have no idea you have it, and that's a concern because some people who think maybe in our community or others, we're not seeing a lot. There, as you said, the numbers could be much more, but they're carriers, so that if we don't do the social distancing and the 6 foot and all these guidelines, they might have it, not know it, and they go interact with someone, especially that's compromised with their immune system or they're elderly, and that really will take effect and hurt folks. So maybe.
Yeah, asymptomatic or minimal symptoms or symptoms that are not recognized. The role of people with truly no symptoms in transmitting this is unknown, probably not a big piece of it.
Okay.
When we look, there are 4 or 5 clusters of people transmitting to others without recognized symptoms. They're all reported from China at this point. China and Singapore, maybe, I can't remember.
Okay.
4 or 5, and they're all in families. And that suggests that where it occurs is under, in situations where contact is extensive and prolonged.
Okay.
We're not seeing those reports from out in the community, from workplaces, that sort of thing. All the reports of pre-symptomatic or asymptomatic transmission are family clusters so far.
Okay.
And so I think it happens. I think that at the end of all this, it will be shown to be a minor source of transmission, but it's not zero.
Right. There are people, and that's
yeah. And we have people who say, well, yeah, I'm coughing, but I have allergies, and so I cough sometimes. Well, it may have been allergy last month, and this month it's COVID. And,
right.
And so people have to pay attention. New or worsening symptoms, cough, shortness of breath, fever, at this point need to be assumed to be this until something else has been clearly identified, and that's very difficult to do.
That's right.
So essentially, when you're sick, you stay home.
That's right. And
you limit your exposure to other people until you are well.
Very good.
And with or without a test.
All right, thank you. We talked about rescheduling, and something that I've talked about a little bit, and some of the other people, the protection for our first responders. Of course, PPE is a big discussion, both at the state and national level, and everyone. If people don't take this serious, and the spread increases, and then because we're not taking it serious, it gets into our first responders. And I've been telling people there is no plan B basically for them. If they get sick, if they come up with symptoms, and whether we have to quarantine because of travel or we have to quarantine because of potential exposure, etc., we don't have people that we can just point to and say, go do that job. It's very important, I think, and I'd love to hear your thoughts for the community, to add that to everybody's thinking about how important it is to mitigate the spread and limit your exposure. If for under no other reason, we want to make sure our people that are on the front lines doing the work don't get this.
Yeah, this is really dealt with in healthcare with a simple concept called standard precautions, which means essentially you don't catch things from the people you know have it. You catch things when you're not paying attention and miss it. So there are certain things that we have to do all the time. If you're a healthcare worker working with a patient who's coughing, you need to protect yourself with appropriate barriers. And our first responders need to do the same thing. We get complacent when everything's fine and there's no flu epidemic or no COVID epidemic, but we have to protect ourselves at all times. And as citizens, we need to be alert that we're not exposing people to something. So first responders, healthcare workers need to use recommended barriers in appropriate situations. And those of us who aren't in those jobs need to alert people if there's a possibility that we're sick, if we're coughing, those sorts of things. I call that manners.
Right. Trying to be nice and.
Yeah, but it's always important in an ideal world. We don't live in an ideal world, I guess. But right now, people have to be very carefully. And the social distancing piece is critical.
Yes, sir.
You need to stay 6 feet away. And 6 feet isn't made up. When I cough, the big chunks that transmit flu and COVID and other droplet infections, they tend not to go more than 6 feet. So if you stay more than 6 feet apart, you're protecting yourself. Sensible decontamination of the environment when somebody's coughed or when you cough on something. All those things, they're based in evidence. It's not perfect evidence. 6 feet isn't perfect, but it's a pretty good estimation when somebody's coughing of how far they're going to spew things.
Okay.
So we're trying to make recommendations that can be lived with, and then we're asking the citizenry to pay attention and live with it.
I hope they heard that last sentence, so yes.
I don't want to say get over it, but I'm saying get over it. You got to stay 6 feet apart if you care about your own health and if you care about the health of the person that's 6 feet away from you. And it's very, very important. Hand washing, appropriate environmental decontamination. Those are critical to do what you refer to, which is flattening the curve.
Yes, sir.
Push the peak number of cases during this epidemic below a level that will shut down healthcare, that will shut down first responders, that will shut down law enforcement, everything. It's not just about healthcare. Right. It's about everything that happens in society.
Yes, sir. Thank you. And then I think you kind of answered this, but I'll just, because it's probably one of the ones that I get, many of our folks get when we go out and talk with people about the social distancing. And yesterday I was with some pastors, mostly on teleconference, but people are asking, what can we do to help? And tell everybody, whoever you influence, your sphere of influence, about the seriousness of social distancing and the 6 foot. So, but then the next always question is, well, how long do you think this is going to go? Because I think people, the unknown just messes with your head. And we know this is, I think most people that I talk to know this is not a next week we're done and have a nice day thing. Probably most people are now getting the understanding of where, as you said, sir, probably in the months versus weeks time. So if there's anything you could add to that question.
I don't have a crystal ball.
Yeah, sure.
And it is obviously the question that I get most is how long do we have to do this? There isn't a lot of evidence that tells us. We can look at the experience in places like China, Korea, Singapore, and Hong Kong. And they got control over a period of weeks. In China, as they recognized what was going on in mid-January and how serious it was going to be, they implemented a series of social distancing efforts that probably exceed what we can do here, legally and culturally. So that was the middle of January, and by the end of January, end of the last week of January, they started to see a decline in cases, and they controlled things in a period of about 5-6 weeks. I'm quacking.
I got
it. And similar initiatives in Hong Kong, Singapore, and Korea. The question, we haven't approached the stringency of the measures taken in those places where they got control over a period of a month to 2 months. We're only 3 weeks, 4 weeks into what we're doing here.
Right.
So talk to me in a month and I'll tell you whether we've been successful. We're watching the number of cases in Scott County and Rock Island County And we're looking for an inflection point upwards. And if we see that, we're going to ask for more difficult social distance.
Right.
And I have no crystal ball. I don't know if that's going to happen. I think it is going
Okay.
to happen. I think things are going to get worse before they get better.
Right.
As I've been saying now for about a
You
month.
have, yep.
And people need to be prepared for that. I know people don't like uncertainty. I get it.
Right.
I spent from approximately 1980 to 1985 not knowing what was going on with my AIDS patients. And every day I was taking care of these patients, and I was uncertain. I thought I knew how it was transmitted. I really did. But I wasn't certain. And I went for 5 years wondering if I was missing something, and my staff and I were the next people to get infected.
Right.
That's 5 years. I don't think this is going to be that long. I know it's not going to be that long. We know pretty well what's going on. But this is the long run, and you need to be thinking about weeks and months.
Okay.
And if we're diligent, it'll be weeks. If we're less diligent, it'll be months. The other thing I would say is that new details of the epidemiology are described frequently, and we're going to adjust our messages and our recommendations according to the evidence. We're not going to be perfect. We will make mistakes. There is no doubt about that. But expertise and sober reflection on the data as it develops, not your gut, is how we have to deal with this. People have to bear with us, and we're going to do the best we can.
And I appreciate that guidance and that knowledge. I think at least for Davenport and the community here, it is important to hear from us, but especially you guys who have the experts. And I'm a firm believer, and that's why I asked you here, sir, is we have people that know what to do and what's going on, like yourself and others that are working on this. So your message of taking this serious and helping us control that curve so that we don't have a longer time and that we don't have more exposure, I think is important. And I'll just finish with a few words. And again, thank you, Dr. Katz, on behalf of Davenport and the community, coming and giving a few time, because I know you're very busy. So it's very much appreciative for you coming. So Davenport, let me be real serious and kind of emphasize a few points here if we can. I know I've said it before. Many people have said it before. You've heard Dr. Katz today, and you've heard him other places, and you hear our national and state leaders and health professionals talk about the CDC directions and guidelines and requesting to maintain that 6-foot distance. It's now more important than ever because our uncomfortableness right now, we have to just deal with that. As you heard him say, get over it. I agree with that. We have to deal with this now. And be uncomfortable so that we can mitigate the spread. And just because our community is not like some of the other larger communities as far as data goes, we still have it here, and we need to practice that social distancing. So a little special request to my friends in our churches and pastors, et cetera. You have an influence and you have an outreach that maybe some other of us don't. So please, to the youth and everyone else, pass on to take it serious. Here in Davenport, we talk every day about what to do and how to mitigate and all the things and efforts we're doing. We're trying to maintain a balance with the need for mental health and social distancing requirements, because we want you to go outside and have an outlet. But here's what I'm seeing, and here's the concern. If we continue to see groups of people, whether it's at our parks or gatherings or other locations, not following the CDC guidelines or our health professionals, in the social distancing of 6 feet or gatherings of less than 10, then it'll be up to me and others to enact directives and things that'll make you more uncomfortable. So I'm asking you, and please, as best as you can, I know it's not comfortable right now, but those gatherings, whether it's on a basketball court or anywhere else, of 10 or more, we've got to police ourselves basically right now. And talk to each other, even though those conversations might be uncomfortable, and you don't want to go say to your neighbor, hey, spread apart or step back across the driveway, et cetera, or step across and back across the basketball hoop, et cetera. We've got to do this. It's up to us, Davenport and the Quad Cities, to help stop the spread of COVID-19 in our community. by following those guidelines and staying 6 feet away and not being in any gatherings. If you're out at parks, if you're walking on the trail, whatever you're doing, you see someone coming close, step a little bit to the right or left. You guys can do these little things, and we can get through this. So this is serious. All of us need to follow the directions. These are not, just made up things that someone said, you know what, let's think about doing this. These are actual steps that will help mitigate. And the longer we don't do these, the more you're going to force people to enact directives to tell you, and then we're going to have to enforce stuff. But the real thing is we want to get that curve down, and we want the health professionals, our hospitals, et cetera, for people who are actually sick and get COVID-19, they can deal with it and treat these folks as best as they can. So that's what we're talking about, whether it's your loved ones or anybody else's, whether it's people that are compromised with their immune system or elderly, et cetera. We want to mitigate that exposure. You need to help with us. So your personal wishes of doing something, you need to do that big pause we've been talking about. Should I do this or should I not do this? If it's something that's going to cause you to be close to a bunch of people, you should not do it. We want to get through this, and we need your help. So again, Dr. Katz, very much, we appreciate the work you guys are doing. We thank you for coming today and giving your guidance, and be safe, everyone. Wash your hands, follow the CDC guidelines, social distance, and talk to everybody, and please help with that. Thank you, and God bless.